Doctor who treated Bondi Junction mass killer referred to health regulator. A psychiatrist who treated the man behind a fatal stabbing rampage at a crowded Sydney shopping centre will be referred to health investigators after a coroner's inquiry. Joel Cauchi, first diagnosed with schizophrenia in his teens, was unmedicated and homeless when he stabbed 16 people inside Westfield Bondi Junction in 2024, killing 6. The New South Wales coroner said Dr. Andrea Boroslavac had provided 40-year-old Cauchi exemplary care over a long period, but failed to heed warnings from family that he may be relapsing, years before the attack. This mistake was one of many that led to the tragedy, the coroner said, also pointing to a series of actions by police and shopping center security. 6 people: Dawn Singleton, 25 Ishwan Chang, 27 Jade Young, 47 Ashley Good, 38 Faraz Tahir, 30 in Pikriya Darkia, 55 died during the attack in April 2024. 10 others, including Good's baby, were injured in the 6 minutes before Cauchi, who was suffering a psychotic episode, was shot dead by New South Wales NSW Police Inspector Amy Scott. During a 5-week coroner's inquest that finished last May, the coroner heard from dozens of witnesses including doctors, police, survivors and the families of victims in a bid to unearth the events leading up to the attack and prevent such a tragedy occurring again. The coroner's 800-page-plus findings were due to be released at the end of 2025, but they were delayed as a mark of respect for the victims of the Bondi Beach attack, in which 15 people were killed by 2 gunmen on December 14. On Thursday, Teresa O'Sullivan told the coroner's court that Boroslavac had provided personalized, consistent and compassionate treatment for Cauchi for many years after she first took him on as a private patient in 2012. Between 2018 and mid-2019, the Queensland psychiatrist had worked closely with Cauchi to wean him off the medications he had been taking to treat his condition, a move that was not criticized by the coroner. However, in late 2019, when Cauchi's mother raised concerns that her son was possibly relapsing, Boroslavac failed to take more active steps or to recognize the seriousness of the situation that was unfolding before her. She said it was a major failing for the doctor to not do more to proactively urge Cauchi to resume his medication. When Cauchi moved to another city and came under the care of a different doctor, a discharge letter from Boroslavac also failed to provide enough information to prompt intervention, the coroner said. It didn't emphasize the need for Cauchi to see a psychiatrist or that an urgent review of his case should be a priority. O'Sullivan's recommendation that Boroslavac be investigated by Queensland health authorities followed calls by some of the victims' families for such action. She also found there was a missed opportunity for police intervention after an email raising concerns about Cauchi's mental health was not acted upon due to staff shortages. The officer overlooked a single email amidst a significant workload, O'Sullivan said. The inquest heard a security guard who was the sole person in the CCTV control room at the Westfield when Cauchi attacked his first victim was not competent for that role. However, O'Sullivan said this was the fault of the shopping center, which has since improved its processes. Among her 23 recommendations, O'Sullivan also called on the NSW government to improve its mental health outreach services and provide short-term housing for people with mental health issues. The coroner praised the police and emergency services response to the stabbings, describing them as commendably rapid and extensive, but said there were issues with the interoperability between various agencies that could be improved. She also recommended a public awareness campaign with the message of escape, hide, tell when there is a situation with an armed offender. O'Sullivan, though, did criticize some media COV.